The consumer mindset has shifted considerably in the past year. And for healthcare communications professionals like us, it's perhaps never been more important and perhaps even more complex to reach consumers in meaningful ways. We heard all about this mindset shift in the last really fascinating discussion with the folks from M-Booth, where they shared their recent data on the emboldened, savvy consumer, which was really exciting to hear about. But beyond that excitement that's catapulting vaccine brands and others to household names, this next panel is going to examine what we need to know as healthcare communicators about the drivers of this new consumer and their evolving needs. So, for example, how do we reach people in trusted ways? We know from the 2021 Edelman Trust Barometer that trust in all information sources is at record lows. So what do we do about that? And how do we find trusted ways to reach people? How do we motivate people to take action for their health? Harris recently shared that more than 2/3 of adults are hesitant to attend routine in-person healthcare appointments, and 57% are hesitant to even go to the hospital for an emergency. So I'm really pleased to introduce our next panel called Internet MDs, Communication Strategies in the Age of the Sophisticated Consumer, where we'll learn from communication leaders from Merck, Cvs Health, and Real Chemistry about how they're making an impact and how we can learn from that. So now I'd like to introduce Madeline Malia, practice leader from Real Chemistry, to lead the discussion.
All right, thank you very much, Michelle. So here with me today, we have Claire Mulhern, Associate Vice President, Corporate Communications and Head of Health Communications at Merck, and Bill Derling, Vice President, Communications at Cvs Health. And in a minute, I'll have them sort of introduce their current role and focus at each of their companies. But just sort of building off of what Michelle was saying, the consumer mindset has definitely shifted. We've seen a lot of changes over the past year. How we're acting personally and professionally and engaging with our key brands is very different. We stopped leaving our houses. We started shopping more online. I'm personally guilty. Started using electronic devices more and phones more. Many of those things I didn't think was really possible. We found new shows to watch on Netflix. Netflix stopped going to the doctor. Most of us, I think, have tried consulting online with a healthcare professional at least once, and increased our attention to our own health and wellness. Rumor on the street is that some of us, I may be guilty, have gained up to 30 pounds during the pandemic. And with that comes an increased focus on how we're going to get back to health and take care of ourselves and our family. So there's a lot to dive into, and we're going to focus today's panel on diving into a couple sort of specific examples that Cvs Health has really experienced and how they've shifted their strategy very quickly over the past 12 months. And Merck also, how we're looking at engaging in consumers and how you've shifted your strategy. So before we dive in, we thought it would be good to sort of ground us in how do we define consumer? Because it's sort of different to different audiences, people and individuals. And as we look at the world where relevance and reputation and trust are so important among the consumer, trying to figure out how we reach them without boiling the ocean, as sometimes we're all guilty of doing. How do you really make an impact? So, Bill, perhaps we can start with you. When you think about the term consumer and how you and Cvs Health look at defining consumer, what does that mean to you?
Yeah, so thanks, Madeline, and thank you for having me here. I'm looking forward to the discussion. So I lead communications for Cvs Pharmacy, which is the pharmacy that I think probably everyone on the call is familiar with. We have close to 10,000 of them around the country, both standalone stores and in Target's stores around the country. So when we look at consumers, we really truly look at the general population, but we look at that differently in terms of who views us as a convenience store, which we are. In some places and communities, we are a grocery store. We are a pharmacy. We are a primary care provider through our minute clinics, our 3,000 minute clinics. And so for us, we serve the broader US population, but we do look at the sort of sub segments of our consumer base differently. We are we know that we have people who come into our stores looking specifically for health and wellness and for pharmacy and prescriptions. And at the same time, we know that people do just enter our stores, as I said, for convenience, for toiletries, for a bottle of wine on the way to visit someone's house for dinner. So we truly look at the broadest segment of the population, knowing that there are clearly differences in priorities for shopping preferences and healthcare needs across that population.
Thank you. And you, Claire?
Yeah, no, thank you, Madeline. I'm really glad to be here with you and Bill. I'm Claire Mulhern. I'm an AVP in our global communications team here at Merck, and I lead a new function that Dr. Julie Gerberding, our head of communications policy, patient engagement, and corporate responsibility, asked me to take on at the end of last year, which is health communications and engagement. And really, myself and my team are focused on leading our corporate insights, reputation, and in communication strategy to impact health equity and impact on consumers, patients, and communities. So really trying to dive into new segments from a corporate perspective. But, as you and Bill and I were discussing earlier, when we think about the consumer, we can have the tendency to boil the ocean. But I think, as Bill said, you really need to think about it in terms of the segments that are appropriate for your business and who you need to reach. So when we think of Merck and our portfolio, which is largely, we're medicines and vaccines developing oncology, vaccines across a number of different areas, HIV, really a specialty company, we really think about the patient or the consumer based on our business. So that really could be the oncology patient or those that are at risk. When we think about the vaccines, it's really populations that we're looking to vaccinate across a wide variety. So that could be your mom and dad that are potentially having to vaccinate their child or others. We also think about it in the context of clinical trials. We're a huge research intensive biopharmaceutical company. So we think about it in the context of volunteers for our clinical trials and actually how you're reaching the consumer to potentially participate in clinical trials. And we fully recognize in this day and age, there is some mistrust from certain communities in the clinical trial process. We also think about it in terms of, future potential employees. We need to reach the consumer and their interest in potentially joining our company. I think the other piece that I also wanted to mention is that we actually have an animal health business. So we're also reaching the consumer as we think about somebody who's a pet owner. So we really have a wide variety of segments that we're trying to reach as a company in terms of the consumer.
Yeah, and I think later in the discussion, it'll be interesting to have some more time spent on how we look at employees as consumers and sort of tailor some of the communications that we're working on for our employee base as well. But so just to start diving into some of our key topics here. So, one of the things, and again, I think a lot of us as communicators and marketers have been paying close attention to kind of what's happening from a consumer standpoint with all of the shifts happening. What we saw is that how consumers are paying attention to the brands they sort of love and have loyalty to is changing. The way they're paying attention to how their brands are showing up in the world, what they're doing and what they're saying. We're paying closer attention to what's happening in our communities collectively. All of us are doing that. And favoring convenience over loyalty, favoring convenience and relationships over what has historically been brand loyalty is also a really key area. So when we look at that, and while many of us have been pivoting rapidly, what feels like daily and weekly and monthly since last March, few companies have been sort of quite on that pivot line as Cvs Health. So Bill, wanted to hear from you a little bit more. When you think about those trends that we've been talking about that, and as we've been sort of adjusting our strategy, what has CVS Health been doing? What have you seen how that's been playing out in real life?
Yeah, thanks, Madeline. Good question. So when we look back at last year, and it really was a little over a year ago that we first started to see the impact in our stores when the pandemic hit, people started working from home. And so the first two things that we saw were that people were panicking. And so people who had, say, 90-day prescriptions just started filling their prescriptions because their mindset was they didn't know when they would be coming back into a store. At the same time, we saw people who, when they did come into a store, the first thing that they did was buy hand sanitizer, paper towels, all those cleaning products. And so, we, like other retailers, had empty shelves within a matter of days and weeks in some communities. And so from there, we also saw some pretty significant changes in consumer behavior from a pure sales perspective. So sales of cold and flu medicine dropped off. People weren't getting sick because people started wearing masks. And then, what really started to change for us was when we opened up the first mass COVID testing site in Shrewsbury, Massachusetts. It was just a little over a year ago, and I live in New Hampshire, so I was there for the day when it opened. And from the very first testing site that we opened, we saw how important the sense of community was, and how important hyper local communications was going to be as we rolled out these testing sites around the country. And so what we saw was that from that first site where we were doing outreach to first responders in the town as sort of our trial run, that expanded so that every time we had a new announcement for a new test site, it was definitely a team effort and a huge focus on partnerships that resulted in awareness at a local level that quite frankly, I hadn't seen that level of effectiveness before. So, as I said, we have about 10,000 pharmacies around the country, but when we would open up these test sites, within the span of a day, our team would be talking to the White House when in the morning, finding out maybe when some of these or what the test reimbursement cost would be, to working with the state governor's office, to a local mayor's office, making these announcements to say that these test sites were available in communities. And so one of the things that really struck me, we kept this process going, and it was nonstop, things changing from day to day as we opened up in more states and in more sites. And then, we got closer to the end of the year, and we were doing a recap of the amount of revenue, quite frankly, that was generated for the company. And what was fascinating about everything that we did around testing from a communications perspective was PR clearly led the way. In fact, we really didn't spend any meaningful marketing dollars at all in terms of building awareness for our test sites around the country. So when we look back at the amount of revenue that we generated for the company, because the tests were reimbursed by the federal government, we saw that, and I can't give you the exact numbers, but the fact that we talk a lot about, particularly in PR, about how we can work to enhance a company's reputation, and we provide air cover for the brand, and we protect the reputation, and we don't always feel comfortable talking about PR as a revenue driver or lead generation, or depending on what type of industry you're in. So what was fascinating when we saw the financial results that came through in terms of the impact that we made to the bottom line of the company through PR, by building awareness for these test sites through PR, it was, again, without giving numbers, it was in the hundreds and hundreds of millions of dollars. So for me, somewhere down the road, when things maybe calm down a little bit, I think it would actually be a great case study just to show how important that PR can be. And what was also interesting is that we talk a lot about the demise of local newspapers and local TV stations as a news source, but they really were our sort of bread and butter through this entire, particularly the initial testing rollout, because we would see the direct cause and effect. We were very careful about making sure that we wouldn't make announcements until we knew that the scheduler was working perfectly, so that the next morning when we coordinated with the state or local government, we reached out to local newspapers and TV, and we saw direct results within literally, within an hour of something appearing in a local newspaper online or on a local TV station. We saw people showing up at our drive-through test clinics. So, on one hand, we saw that it had a tremendous connection through local media. At the same time, as we started to roll out more and more of these test sites, when we got into certain communities, particularly some inner city communities, we saw that it was sort of a wake-up call, because everything, the playbook that we'd been using up to that point of, okay, we'll work with local government, the mayor or the governor will do a press conference, we'll reach out to TV. We saw that as having zero effect in terms of generating awareness for these test sites. So we pivoted, working closely with our diversity and inclusion office and with local government officials and for our own local government teams. And we use some, for us in sort of big corporate America, were non-traditional methods. So we started reaching out to church groups and getting inclusion in, paper newsletters that were being mailed to people's homes. And so, for all of the emphasis that we place on sophisticated digital media, we were at times we were working with newsletters that were being typed up and sent to people's homes. So it was quite a shift from, and at the same time, yes, we knew we needed to build awareness at the national level as a brand for what we were doing. But in terms of bringing people into our stores for that crucial testing, and I'll talk about vaccines a little bit later, but those initial, and still to this day, we're driving awareness, almost, pick a number, probably 95% of that was all through PR. So it was quite an impact on the business and, providing a great service for the country.
Yeah. So Claire, how does that sort of, resonate with what, how you've been working over at Merck and how you guys have been shifting your strategies, particularly that sort of movement from recognizing you need to have that national impact, but that the shift really needs to happen and be customized much more on that sort of local and almost personalized community approach.
Yeah, no, thanks, Madeline. First, Bill, I just have to, hearing you now and also in the conversations we had before, this truly is a great case study to show the power of PR on business outcomes and impact. I think we all struggle as communicators on how we tie our engagement KPIs to ultimately business impact. And we all say, never let a good crisis go to waste. And this is a great example of, how you guys brought that through. I think we saw very similarly as the pandemic unfolded and everything was impacting our business, is that we needed to keep things going and information needed to come out on a regular basis in terms of what we're doing through, our social channels, obviously internal channels to our employees and things like that. But I think one of the reasons that my new role was stood up is that we really recognized is we needed to get down to the localized level, just like you guys did at CVS, and have a communication strategy that looked at those local communities. Because I think ultimately at the end of the day, how you communicate in Wichita, Kansas to Brooklyn, New York is going to be very different. Right. And to your point, Bill, ultimately this stage, while people are looking at their phones and using digital devices, you can't dismiss that newsletter that you get from your church or, the community that's there and then infrastructure that ultimately for certain communities is embedded in how they ingest their news. And so I think that we've recognized that as well and are trying to bring that through across not only our business communications and product strategies as we're supporting the business, but also how we're looking at it through from a corporate communications lens.
Yeah, I know, Claire, you and I have talked about this, the idea of sort of blending the old with the new has sort of never been more apparent than it is right now. Leaning into some of those, what I refer to as like 1980s PR tactics that some of us may have grown up with, and blending that with.
To my knowledge, we didn't actually use any fax machines, but I think we did.
Do you remember the days when we had to cut out the clips and put them in the clip books?
I was going to say, yes. We didn't have to put together clip books for our internal stakeholders. So that's kind of a win. But yes, the blending of the sort of old school with the new has sort of never been more apparent than kind of what we're seeing right now. So one of the other sort of topics that we've been kind of thinking about is, as it's a nice segue to kind of the next section, is, what we're seeing right now in terms of trends is that overall, we're at a moment in time where healthcare is top of mind for everybody. From, talking with your neighbors to, like, my mom knows more about clinical trials than she's ever known about clinical trials before. That pharmaceutical companies, for potentially maybe one of the first times, as really increased in relevance and is looked at as truly a trusted brand or group overall. And while people really want to connect with their doctors, that's something else that's come out, that having that real personal connection with people and physicians, while at the same time, no one's going to their doctors, or they're starting to get back to the doctors. And you've got this really noisy landscape. Most of us are all trying to figure out how we communicate in a world where everyone's really focused on COVID. Sometimes we've got COVID news, and sometimes, we're talking about something else. So how do we leverage and lean into those traditional tools and some of the newer ones to really break through the noise? So Claire, I thought you might be able to talk a little bit more specifically around some examples that Merck's been working on to cut through that noise and sort of leverage that interest in healthcare right now.
Yeah, sure. Happy to comment on that, Madeline. And I think one thing I wanted to comment before is I think Michelle in her opening spoke about some of those stats, not only, the Edelman Trust Barometer, but also, the impact that we have seen from the pandemic on, obviously patients going into the doctor office or consumers going into the doctor's office. On the trust piece, I think we have seen a lift, as you said, from an industry perspective. And the challenge will be for us to continue that with the general public and consumers. I'll comment, Morning Consult recently just issued their most trusted brand survey that they did this year across multiple markets. And for the first time ever, we're actually seeing 2 pharmaceutical companies be listed on that with the likes of Google and PayPal and other. And so that really speaks to, the consumer recognition of science and what we really can bring to the table. And I think that's wonderful to see. But on the flip side, as you said, the pandemic has really created a void in terms of the consumers feeling comfortable going into the doctor's office. As a company that makes medicines and vaccines, we saw an immediate impact on what that meant for parents as well as older adults going back in to get their well visits where they could actually receive their routine vaccinations. And so we recognized, not only, the government, et cetera, was focused on obviously COVID, but also communicating the importance of continuing that routine care. But we also knew as a company, we needed to step up individually as well as working with partners to reinforce that message. Because what we didn't want to have happen is, a huge segment of children today were not receiving their vaccinations, and we could see in the future an actual increase in cancer rates because of that. So we actually took a more of a digitally focused strategy, a multi-pronged strategy that was all grounded in data and insights on actually what was the challenge for consumers as well as the stakeholders that influence the consumer. And so what we realized is that ultimately say, take for example, parents of kids, ages 11, 12, et cetera, who would be going into the pediatrician, they were scared to go into the doctor's office because they didn't know if it was going to be safe. So they didn't want to go in for their routine visit and potentially receive those vaccinations as well as all the other care that's needed for their kids. And so we launched a multi-pronged social media as well as search strategy to really combat that concern, because ultimately, if the right measures were taken, it was very safe to go into the doctor's office. And so we launched a paid social media campaign over a 12 to 18 week period that specifically looked at moms and dads of appropriate age children to help them understand that it was safe to go into the doctor's office with the messaging that was focused on that we tested before we rolled out. We also recognized there were two critical audiences that we needed to reach as well that would support that. So first was the HCP and the doctor, and delivered a similar message to them that they should be communicating with their consumers and with their patients that it's okay, their doctor office is safe, and that they can come in for their routine care. We also took a very targeted strategy in the New York area, specifically recognizing that there needed to be alternative means for consumers to actually receive their routine vaccinations. So we actually launched a social media effort targeted at policymakers to potentially change legislation in the New York area that would enable pharmacists to actually give routine vaccinations. And through that effort, as well as partnering with our policy team, we actually were able to see that legislation change, which enabled that to happen. So it actually broadened the scope of where parents could actually take their children or themselves to receive those routine vaccinations. So we saw a significant impact. We also did a public service announcement. Those in the tri-state area, I live in New Jersey, you might see actually the health department doing PSAs right now on local TV about making sure you're going in for routine care. So we wanted to support that with additional messages. And actually, we gained a lot of learnings out of this campaign and are going to be evolving it as we go forward, particularly as we think about children ending school, going into summer and return to school, and the window of time that if you are going to receive a vaccination, particularly as, hopefully vaccination rates for COVID drop down to 12, that there's that 2-month period of washout where you can't actually receive other vaccinations. So we're going to be expanding our campaign and doing a broader public service announcement with a celebrity as well as a well-known patient advocacy organization focused on this message. So more to come very soon on how that will roll out.
So one thing I definitely hear from both of you as you're sort of giving these examples is that there's a couple kind of big themes that are coming through. One is around sort of innovative and new, perhaps strengthened collaboration and integration with your internal teams, as well as really identifying those key partnerships outside of both of your organizations. So I'd like to hear more about that. But I also recognize that for many years, for most of us, and from my experience of being in-house for a number of years, is that we're generally sort of set up in silos in many ways. We all have our jobs and we all work together, and collaboration is always a key piece of success. But what's being required in order for us to really meet consumers where they are right now is a level of integration and collaboration across these teams in a way that perhaps we haven't necessarily leaned into quite to this extent. So I think it'd be interesting to hear from both of you sort of what, is that true statement that I'm making? And then also sort of how you've worked, what you've been finding, what's some of the surprises and what are some of the learnings that you've had. Perhaps Bill, you can take that one.
Yeah, thanks, Madeline. When I was talking about the COVID testing that we had set up last year, what was fascinating about that was that we essentially created a brand new line of business on the fly. And what we discovered from the work that we did on testing that really helped later with vaccines is, we started having these I think, rather large working groups that would meet on a daily basis. And those working groups were not just communications people. It was the communications team on the phone with, government affairs, with legal, with, finance, with the operations team that was on the ground setting up the business. And so, what we discovered is that the having that sort of mass of people working together real time. There were people particularly during the pandemic that I'd never met before, didn't, brand new names, and so these weren't people that we had to establish relationships with. But what we learned from that was that that ability to be flexible and use speed of communication as an asset was really important. And in fact, if you haven't read, there's a great book by Stanley McChrystal called Team of Teams. And it's how to work.
Great.
Yeah. And so, for example, what we learned from testing, by the time we got to talking about vaccines in the fall, I had a daily call of about 170 people on it that was, mostly non-communications people. And because what we found was that, particularly around vaccines, decisions that were being made at the federal government level, we could have perfectly well laid out plans that morning, and by the afternoon, there was, some new news that came out that needed to not only shift our communication strategy, but shift our whole operation strategy for the following day. So having that ability to have that many people, where you didn't have to wait for a chain of command to get that information, cascaded. By the time that information would have been cascaded, the whole playing field had shifted already. So, what we saw, there's sort of both, there are limitations to 190 people on a call, but at the same time, we took a subset of those.
And a lot of limitations, I'm sure.
Yeah. But narrow that down to, probably a 35 to 40 person working call. And it's a call I still have, 5 days a week right now. Sometimes that call lasts 10 minutes for a quick update. Sometimes it's an hour. But what it allows you to do, from an internal perspective, it allows you to move quickly and allows for that consistent messaging to the consumer that I think can sometimes fall apart when you're just running so fast and you have one part of the business that is, sort of developing their own messaging and another part's developing their own messaging. So I think that ability to work in large groups and have that speed and flexibility, because the principle being that the more information you have, the better your decision making is, and the further you can push that decision making sort of down in the organization, as long as you have that context. So, that was one thing that I think I really saw come together, things that we learned from testing that we're still using now that we're doing vaccines, that flexibility and bringing people together, and being able to communicate broadly at a high speed.
Mm-hmm.
Madeline, I would agree with what Bill said. We did something very similar when the pandemic started. Obviously, we weren't on the exact front lines that CVS Health was in terms of the testing protocols, et cetera. And I don't know if we had 190 or 170 people on our phone, but had a very large group. But it helped us to pivot to make sure across our audiences, including the general and public and who we needed to communicate with, whether also if that was, our HCPs, our employees and others, that we were all consistent in the way that we were communicating. And I think that's the key here is that, even though you might have to tailor your message based on the audience or when you actually get down to a community level in terms of the channels you use, at the heart of it, you have a consistent thread that you have, and that ensures that you're communicating in the right way. One thing I want to note that's a little off topic from kind of this operational aspect is I know that, and again, at the beginning, kind of Bill spoke about and you mentioned you kind of got this new business line with the testing, and that was all driven by PR and the reputation that you guys achieved with that. That reputation actually parlayed into, Merck and CVS actually have a partnership on clinical trials. So we've actually, partnered with CVS once they receive a positive COVID test can that individual potentially enroll in one of our clinical trials for an investigational COVID therapy? And so, I think that shows the power of public relations, not only on the immediate business impact that you guys saw for CVS, but also how that can expand potential partnerships that you have with organizations, including our own. So,
yeah, exactly.
One thing that came up a little bit earlier, and I know we had a discussion about it prior to today's panel, is around the idea of employees. And that oftentimes in the past, we've sort of looked at employees and employee engagement as sort of one specific thing, and then consumers and external audiences as another. Most of us in communications always recognize that, and as we should, that anything you convey to employees can also become public at any point. So there's always been that connection. But how we really look at employees as a consumer group really seems to have evolved over the past 12 months. And Bill, you had kind of given an interesting example around how at CVS Health that had come to light for you, and how you sort of, the company looked at engaging employees in a different way in light of that.
Yeah, one of the challenges that we faced early on in the pandemic was CVS, like most retailers, so there are about 200,000 employees who work in our stores and in our field leadership. And most retailers have a challenge reaching those frontline employees who are typically hourly employees. Many of them are part-time. And so, not all of them are that interested, quite frankly, in sort of what's going on from the corporate level. And so one of the things that we found ourselves with the situation in early going was, while we were pushing what we could through our internal channels, we were getting letters and posts on social media from family members and employees themselves saying, I'm not sure I know what's going on. Are we supposed to be wearing masks? Are we not supposed to be wearing masks? Are we getting hand sanitizer? Are we going to get plastic shields? And so while we continue to use our internal channels, you have to remember that not every store employee has an email address. And so we started looking at external channels to reach our internal employees. And so at one point, we actually started focusing on cvshealth.com, saying what we were doing in our stores with a combination of a consumer-facing message and an employee message that says, okay, here's what's happening. Here's what's happening with plastic shields at the registers. Here's what's happening with gloves and masks for our colleagues. Here's our mask policy, because we knew that we needed to do something different than just our traditional methods to reach our 200,000 store employees. So we really started using external channels in a very specific way to augment our internal channels.
Yeah, I thought that was interesting, and I imagine, Claire, in many ways that's true for Merck too. I think companies all struggle with the best way to reach employees, what employees want to hear and when, but at the same time, they want to know what their company is doing. So how does that sort of resonate for you?
Yeah, no, very similar. We have obviously a very different employee structure with office-based employees, as well as those that are in our manufacturing lab and as well as our scientific labs. But I think the key here is that at our company, first and foremost, we recognize that all of our employees are humans and consumers first, and their health comes first. And so that was part of our overall strategy, obviously, when we went into the pandemic. And we actually recently had a conversation of, how do we actually also think about the health and wellness of our employees when we think about return to care? Because we fully recognize that many of our employees might not actually be receiving their routine, mammograms or colonoscopies or going into their doctor office to get that. And so, we've recently had a discussion of how we can support that. And ultimately, it gets down to kind of the discussion we've been having, what's happening at a local level. and what governments are saying and others, and how we need to make sure that when we're communicating with our employees about them being consumers in their own health, that we're taking that into consideration. So that's definitely something that we've, are plotting out in terms of our communication strategy. I will say, we didn't use our external channels like Bill and his team did to reach our employees specifically. We focused a lot on internal channels, establishing kind of a dedicated page for everything related to COVID and what they needed to know for their health and their family's health. But I love that idea, Bill, of how you guys needed to reach your audience, particularly with the part-time employees, leveraging your outside channels. I think it's something we should all look at.
Yeah, I will tell you, CVS, we talk about leaning into our communities, I told Bill already, CVS is really like an extension of my house and my family. It's right down the road, and we go there for everything now. So we just have a few minutes left. But so I wanted to ask you, first question, and maybe Bill, this could be for you, is, what do you think kind of the one thing that you've been surprised by, or so the one thing that you think is really going to stick when we come, as we sort of move out of the pandemic in terms of strategies for reaching consumers?
I think the thing that will stick is the reminder that there is no one good channel. That you really have to use everything and anything you can in the toolbox, even some things that have been buried deep in the toolbox for a while. And you have to ground for them to find. And so, it was. I remember during that when I was talking about reaching out to community groups and everything. I remember being almost maybe a little embarrassed that I hadn't, that I just sort of assumed that everything that we were doing was going to reach everybody that we needed to reach. And when I told about it, I was like, yeah, you know what, that really makes a ton of sense. Yeah. And that's a great example of, truly understanding who you're trying to reach and how to reach them. So that was an eye opener that will stick with me for a while.
Yeah. What about you, Claire?
I personally, I have to wholeheartedly agree with Bill. I think that this is, came to the forefront for us that we need to use new and innovative things, but the old still really work well, because ultimately at the end of the day, people are consuming information in different means, because you have to think about, you've got a range from, millennial all the way through boomers, different communities and the like. And so I think that's really critically important. I think the other thing that's going to stick in terms of for communicators and for companies going forward is the consumer expects you to be transparent. And also the speed in which we need to communicate. We all operate in 24/7, but I think that we learned that the speed in which we need to communicate, particularly consumer in a crisis situation, is changed. I don't think anybody has probably seen before how fast this all went. And so my guess is, we won't see that as an enduring trend, but it does show that the speed of information and the way that consumers and everyone consume that has changed. And it's just something we need to consider.
Yeah. I remember when the news cycle was like 9 to 5, Monday through Friday. That's not really.
Again, back to the clip books.
Yeah. And so, and I think one other piece that we didn't spend a lot of time talking about today, but is the tone and empathy really coming through. I mean, it speaks to kind of what you were talking about, Bill, in terms of connecting on a community level, that you have to show up and connect with people in a way that's much more authentic and resonates with the communities and the individuals that you're trying to connect with. So I think we're at time. So in 1 minute, 30 seconds, what's the one thing that you're most looking forward to coming out of the pandemic? I'm sure you've been asked this like 100 times over the past year, but let's hear it. Bill.
Well, I'll go first, I guess. Seeing my family, like this is, obviously it's not tied to our job. I grew up in Southern California, and I live in New Jersey, and I haven't seen my parents or my sister in 2 years. So I think that all of us want to make sure that we're staying connected. And as much as we like to use virtual means, it still doesn't replace an in-person hug. So
Yes, totally. And what about you, Bill?
Yeah, I've been fortunate enough to see my family. I think the thing, and I've eaten at some restaurants outside. The one thing that I'm really looking forward to is listening to some live music.
Yes.
Really
Rumor
miss
on the
listening.
street is it's supposed to be coming back this summer for a couple
Yeah.
things.
yeah.
So, all right. Well, thank you both of you for your time. Really appreciate you coming out and having this discussion with us. And I look forward to talking to you both again soon.
Thanks,
Thank you so
Madeline.
much. This has been great.
Thanks, Claire.